Diabetic retinopathy is when there are changes in the very small blood vessels that are in the back of the eye and the retina. Diabetes is, of course, a disease where the blood sugar is high chronically over time. And of course, you know about medications and insulin to help manage the blood sugar, but you also need to consider the reason that we need to keep the blood sugar under control. And the reason is that it can cause changes in the small blood vessels that are all over the body, especially in the eyes and also in the kidneys. And so not only do you need to have a primary care physician monitoring the blood sugar and maybe an endocrinologist helping with insulin, but you need to be followed by an ophthalmologist to check for retina changes in the back of the eye. There's several different types of changes that can occur. Vessels can leak fluid and cause some blurriness in the central vision. Vessels can also start growing and then bleed, causing new floaters and blurry vision. And in very severe cases, new vessels can also cause traction on the retina, pulling, causing retinal tears and detachments, and even glaucoma. I'd want you to be talking with your primary care physician to control your blood sugar and blood pressure. I'd want you to be coming in for at least annual eye exams. It's definitely something that can blind you permanently if you never get it checked. But if you come into your appointments and work with us, we can definitely prevent you from losing vision. Even though it may be inconvenient or cost a little extra time and money to come in for an eye check, our treatment options are definitely way better and cheaper and less painful long-term if we can treat the disease earlier on. And so it's extremely important to come in early and be checked often. Just watch it every year or so. If there is swelling or bleeding, sometimes we'll recommend eye injections or laser treatments. If it's progressed to the point where there's pulling on the retina or retinal detachment or glaucoma, we'll usually recommend surgery. With Retina Consultants of Texas and Retina Consultants of America, we're doing a lot of clinical studies to develop newer and better treatments for diabetic retinopathy, including the diabetic macular edema or proliferative diabetic retinopathy.